Why is it important that people have a sexual health screen? The main reason is that chlamydia infection is so common in young people. 1 in every 10 people in London carry chlamydia infection. Worst still, chlamydia is like a parasite. It hides inside the cells. You cannot detect it. It doesn't produce symptoms, but yet it can cause infection. So it is so important, if you're sexually active, if you had unprotected sex, to have a regular chlamydia screen. Now, the second worst bacteria is gonorrhea, but gonorrhea tends to produce symptoms quickly, and people always rush, especially males, rush with pain during urination to have tests done. Now, for females, because it occurs in the cervix, on the cervix, it may be totally asymptomatic except for excessive yellow discharge. Chlamydia and gonorrhea infection can be tested for very easily by means of a swab from the cervix or even a urine sample or a face catch urine sample. The results are often available within 24 hours. The problem with chlamydia and gonorrhea is that they can spread to the uterus and the tubes and cause pelvic infection, which is easy to treat, but it may leave adhesions behind, which can cause a fertility problem in the future, both in the males and females as well. If the results are abnormal, you will be contacted by the doctor over the phone, and you'll be advised to come for a prescription or simply pick it up from your local pharmacy, and you will be told to inform any sexual contacts so they can see their doctor or come to the Gynae Centre for testing and treatment. Less common is infection with HIV, and although it was not common in heterosexual relation in the past, in 2011 there were 6,000 HIV cases. Many of them were heterosexual. So it is also important to have an HIV test every now and then in case of unprotected sex, and in particular if it was with a high-risk individual, bisexuals, or someone who received blood transfusions in the past. Then comes syphilis, hepatitis B and hepatitis C, which are less common, but we also recommended if the woman requested a full sexually transmitted disease screen. HIV, syphilis, hepatitis B and C are tested by blood sample, which will show infection 2 months after exposure.